And the information tonight is that the virus can last up to days on some services. And our advice does not end there, of course.
Let's go back to Gianna with our panel of experts tonight. She's been getting in questions all night. Gianna?
That's right. And joining me once again is Dr. Olayemi Osiyemi, who specializes in infectious diseases. Fennell Siegel, an infectious disease consultant, and psychiatrist Dr. Dan Bober. So here's a question from Alexis Hernandez. Let's listen in.
Does that really matter, washing hands? Because it is a virus. So does it actually matter, washing hands?
Ooh, good question, right? Let's start with you, Fennell.
It's imperative that we wash our hands, whether it's a virus, whether it's a bacteria, whatever organism. We often don't know what we're touching. And absolutely, that's what we've been stressing for many, many years, certainly in the healthcare arena. We know that hands are the #1 source of transmitting infections, whether it be during a pandemic with coronavirus, or it be the regular flu, or any bacterial infection, any type of organism. It's very important to wash hands.
Mostly because just how many times do we touch our faces? I mean, I know it's been on my mind more, so I've been trying to avoid it, but I mean, I'm touching my face all day long.
I read something that people on average touch their face 90 times a day, and very often they do it subconsciously. They don't even realize they're doing it. So when you see people wearing these paper masks that don't really help anyway, a lot of it is just to prevent them from touching their face.
Correct. We do teach to keep away from what we call the T-zone, and that's really important because people don't understand that or don't realize that the mouth, the nose, and the eyes are made of mucous membrane, and that's exactly how, especially these viruses, get into our system. So it's really, it's extremely important. That's the two-part process: washing of the hands and keeping the hands out of the face.
Perfect. And Dr. Osiyemi, here's a question we actually just got in. So this says, quote, "I'm 65, I got a flu shot, I'm healthy. What do I need to do?"
Well, I think getting a flu shot is the first thing to do. The next thing is really what we talked about before, is social distancing. When you're 65, you're definitely at risk of getting severe coronavirus. So you want to stay away from anyone that's sick. We're in Florida, where you have the population of elderly patients is very high. So, you know, if you don't distance yourself from someone that's sick, and you do get coronavirus, you're more likely to get severe care. So I think what that person could do is just basically stay away from anyone that's sick and wash their hands.
Now, Dr. Bober, I want to talk to you a little bit about this. How do we talk to our children about the coronavirus? Because you want to make sure that they're informed. You also don't want to scare them. So how do you talk to kids?
Well, you want to do it in an age-appropriate manner, and you want to make sure that you're not too anxious, because kids model the behavior of their parents. So you want to reassure them. You want to let them know that they're going to be safe and that you're going to protect them. And again, you want to just do it in a way that's sort of common sense based on their age.
Perfect. So, Fennell, what about this? Can we get it from food? If somebody who has coronavirus is preparing our food, maybe at a restaurant or something like that, can we get it?
That's an interesting question as well. It's primarily through the respiratory route, but there are a couple of articles right now that are suggesting that there could be some contamination, fecal contamination, and possibly oral fecal. However, it's important to note that at this point in the course of this pandemic, we're not really seeing that as the primary source. So I go back as an infection prevention consultant to hands, and we should be washing hands when we are preparing food, before we eat, because there are many viruses and bacteria that we can spread from food. Is this a primary source for coronavirus? Not that we're seeing right now, but we always stress the hands before.
Of course, of course. We want to thank all three of you, of course, for being part of our expert panel tonight. We really appreciate getting all these questions answered. Todd, let's send things back.